if you have a healthy dynamic, that's great, right? Like that's what we all strive for, right? To have healthy relationships. But I think sometimes with counseling, even though we have healthy relationships, there are times where something might happen, whether it be a breakup, whether it be, you get involved in a really toxic relationship, or you just do have some stuff from your childhood that you struggle with. You kind of get stuck with it, right? And you just need help processing it. And your family and friends can help you process so much to where after a while it may start to weigh on them too. Being able to express emotions is one of the healthiest, bravest things we can do. It's a very natural thing to do. Think about it. When we're born, what's the first thing we do when we're born?
Cry.
We cry. We express emotion. It's one of the most basic, natural things that we do. We don't come out and say, I logically am grateful to be here. Right? We don't say that.
Welcome back to the Haitian King podcast. Today we have a very important guest joining us. She's a licensed therapist with years of experience helping individuals navigate their mental health journeys, specializing in such area. And it's such a big old list. So we're gonna start with, she's a PhD student studying industrial organizational psychology with a concentration in executive coaching, dynamic and experienced professional with comprehensive background, industry organization, psychology, counseling, coaching, organization development, culture and engagement, strategic planning. It's a whole list, man.
It's a whole list.
Yeah, it's
But
a long list.
There's all that fall under therapist.
Yeah.
Yeah, so it's twofold. So I have a master's degree in mental health counseling, and I'm a licensed counselor. So that's one aspect. But I'm also getting a PhD in industrial organizational psychology. So I describe that as like counseling for organizations. So eventually I'll be able to go into organizations and diagnose problems within their like person systems and leadership and job development, that kind of thing, and then help diagnose them and then address issues that they have, just like I do with people.
So this is, for everybody, Julie Este-McDonald.
Thank you.
So, Julie, let me ask you the first question. Mm-hmm. Can you tell us a bit about your background, how you started, and how you get to become a therapist?
Okay, so I started off actually as a pre-med student at Xavier University in New Orleans. And I got to take more sciences and started to question whether or not being a doctor was really for me. And then I took my first psychology course, and I just fell in love with psychology. And so once I did that, I decided to switch to a psychology major. And so one thing, with being a psychology major, you typically have to go to graduate school to be able to really launch your career. So when I was trying to figure out what to do, Xavier had a program in mental health counseling. And I've always enjoyed listening to people's stories and helping people. And so I thought, okay, well, I'm going to go into that. And so the counseling program's about 2.5 years. So I went to graduate school for 2.5 years to get my master's degree, and then started working with Family Services of Greater New Orleans, doing counseling with them. And I just loved it. And the funny thing was, I remember when I first started, one of the first things I said was, I'm just probably going to do like depression and anxiety and probably not do a lot of trauma. I just don't know if I could do that. And now that's one of my specialties is trauma. So,
But the thing that trauma is one of your specialty, and like nowadays we live in 2024 where mental health is a big thing. At least it's more accepted than it was 10, 15, 20, 30 years ago.
Absolutely.
Or whatever. Would you say the fact that now we live in a day of age where it's more accepted, that's one of the reasons, that's what you more, that's more your forte?
Yes, I think that with the dawn of the internet, because when I was first a counselor, the internet was still dial-up, AT&T when I first started. So now with social media, and there's just more acceptance of exploring the areas of mental health and less stigma attached to it. So I think with those two factors, people can talk about it more. Like we were talking about social media and how prominent it is, right? and people almost overshare on social media. We know everybody's business. So but the plus side of that is that there's a freedom that comes with that. And so when we talk about things like our mental health issues, it's not, oh, that person's crazy. It's, oh, this person is maybe struggling with depression or anxiety or schizophrenia or bipolar disorder. And we can talk about these things and have conversations without somebody necessarily having to feel shame about it. So I think that has opened up things in a very positive way to make mental health a more acceptable conversation.
So let me ask you this. So I know, like, in the Black community, especially, like, it's hard to be, like, searching for help. You don't need therapists or stuff like that, counseling, because, like you said, they got a bad stigma to it over the years. But to me, like, I always feel like, mentally, I'm, like, mentally healthy, right? And if I have any issues, I feel like I can always talk to them and, talk about whatever I got going on and deal with whatever situation it is. Right? But I always feel like having a counselor, I feel like you're just telling me what I want to hear. Is that a true statement?
That's a bad stigma that is also attached to a therapist. It's kind of like you buying a friend, or you just got somebody who's like, will sit there and listen to you, and then after that, look at watch and be like, yep, thank you. You can go home.
Thank you for your time.
Yeah.
So
it's like,
I feel like that bad stigma attached to it too. I feel like a lot of time, even though people are within a situation where they feel like, oh God, I need help, but the fact that in the back of their mind they know, okay, I'm just gonna pay for a fake friend or somebody that just care about my money but don't care about my problems. So what's your opinion on that matter?
Well, I would say, just like any other profession, right? Different people get into it for different reasons. A counselor generally isn't going to be your friend. It's a different type of relationship. So we all have those friends that are going to be our ride or die. No matter what we say, they're going to be like, you're right, you're wrong, but you're right?
Yeah.
But that's not what a therapist is designed to do. I'm not there to tell you what to do. And I'm not there necessarily to be your friend, because your friend's not always going to tell you the truth. Not all your friends tell you the truth all the time, right? So as a therapist, I always say my job is to put myself out of a job. So my job is when you come in to teach you skills and teach you ways of thinking and to point out things about maybe your history or the way that you interact with people that you might not have observed before. And so once we do that, we start building sort of like a toolbox of emotional skills. And so eventually the idea is that you have your toolbox of skills so that you can manage your emotions, you can manage your relationships, you develop emotional intelligence, and you say, I'm ready to do this on my own. And I say, great, I've done my job. If you feel like you need to come back, I'll be here. If you feel like you're ready to move on and kind of handle this on your own, then that's great too. So my job is to put myself out of a job. So with that being said, your friends, their job as your friend is not to not be your friend anymore, right? And the other thing that a therapist brings is years of training, a professional set of skills, background in psychology, a background in counseling or social work. So we bring a particular set of skills. Like, to do this, I had to go to 4 years of undergraduate school, 2.5 years of graduate school. After I graduated, 2 more years of training and internship before I could even be licensed. And then we have to do hundreds of hours of continuing education throughout our career. So there's a specific skill set that we bring to it. It's just like, we've talked about before, you don't break your arm and say, it's okay, my friend could just put some Band-Aids on it, it'll be okay, right? We have specific training for a reason.
But let me ask you this, though. But in a sense, I can agree. But let's say if I say, you know what? Okay, what kind of experience do you have? Like, what kind of struggle that you went through that you have the right to tell me? Like, like some people, let's say you grew up on a silver spoon, and I had terrible, upbringing and stuff like that. So I feel like what gives you the right to tell me, like, make it like you can counsel me. And
if you have the same background, you can relate to my pain.
You know what I'm saying? So how would you know what exactly to tell somebody going through anything?
Well, I think there's two different points. So one thing is, I don't tell you to do anything. So my job is to sort of paint a picture or point things out to you. So there's this type of art I think it's called Pointal art, right? And so it's a picture, but it's made out of tiny dots. So you think of yourself as that person that's right next to the picture, right? So you see the dots, but I'm standing further back because I'm removed from the situation, because I'm not in your daily life. So I see the whole picture. So as someone that's got training, got skills, and stepped away from the situation, I'm not telling you what to do. I'm not giving you advice. But what I'm saying is, hey, have you ever noticed how when you date certain women, like you tend to react this way? Or have you ever noticed that you tend to be attracted to this type of personality? I just point things out so that you can kind of say, well, wait a minute. And then we explore. So I point things out and then we explore. And then we kind of look at ways that you can approach things differently. The other part of that is fit, right? So not all counselors are a fit for all different kinds of people, right? That's why sometimes I have a lot of clients that say, well, I really prefer an African-American or Black counselor, because they feel like that experience that we share as Black people is going to be different. We're going to be able to relate differently. And sometimes that's true.
Okay.
So sometimes it's about fit. So if you try one counselor and you feel like there's not a fit and you don't have like a vibe between you and you don't connect, then you can try another counselor. That might not be the right fit for you.
But I mean, is that like something, just like you say when somebody go to the doctor? You think that's why do somebody need counseling? Why you think why you think is that why is it important?
Well, I think that health is important in general, right? So you have physical health and you have emotional health. And I think that we don't honor enough how important emotional health is. And if people go to the doctor every year, right, for a checkup. Well, we're supposed to. Hopefully you do, right? That's how you can be preventative and know that, hey, like something's coming down, or, everything's okay. You go to the dentist, hopefully a couple of times a year. You go to the eye doctor, hopefully once a year. But your mental health is just as important as your physical health. In fact, your mental health can affect your physical health. Things like high blood pressure, diabetes, your cortisol levels that can contribute to stress and extra weight. All of those can be affected by your mental health. They're called psychosomatic symptoms. So if you're struggling emotionally, there are physical repercussions that can happen. Even aches, pains, digestive issues, gut health issues can all be related to mental health.
I got to kind of touch up from a previous question you answered. Mm-hmm. You said, which made sense. You said, like, one thing about having a friend that doesn't qualify them as a therapist, which I can understand. But I guess, let me speak on our relationship where we feel like it's enough. Mm-hmm. Perhaps you can give us your professional experience and no matter whether it's enough or not enough. When it comes to him, he's not a yes man, no I'm not. Mm-hmm. Like we just recently started communicating to one another in English. Mm-hmm. For the most part, it's been in Creole. And I want to say somebody actually overheard us speaking in English, and it was like, are you guys beefing? Because we don't always really argue.
We never agree on anything.
Like something we don't argue, but for the most part, the one thing that we got that's like solid, we got truth. What I mean by truth is, it's kind of like, honestly, I'll tell him the whole truth, anything but the truth. And tell him where I was coming from, why I made the decision, and in two ways he can be like, I see where you're coming from, but that was wrong, or that was right, or maybe I would have done the same thing. And I felt like that type of understanding, or perhaps that type of truth, kept our relationship healthy, in a sense. So, like, I do something that pisses him off, I tell him, hey, that's where I was coming from, and he do something that pisses me off, that's where I was coming from, and then it keeps our relationship aligned. But at the end of the day, he's not a licensed therapist. And one thing I know, 9 out of 10 times, even as close as we are, we don't agree on everything. And then he don't get to tell me what I want to hear. A lot of times I call him, tell him something, expecting him to back me up, and yet he's, in a lack of a better word, chewing my butt, telling me, hey man, you tripping, that was wrong, or whatever. But we've always had that. Let's just say you understanding our relationship, and then yet you're a therapist. Clearly you train for it, you approach it differently compared to a best friend. Mm-hmm. What would be your opinion be on that matter?
Well, I think you guys seem to have a really healthy dynamic, right? And very, you're interdependent, right? You're not codependent, right? So if you have a healthy dynamic, that's great, right? Like that's what we all strive for, right? To have healthy relationships. But I think sometimes with counseling, even though we have healthy relationships, there are times where something might happen, whether it be a breakup, whether it be, you get involved in a really toxic relationship, or you just do have some stuff from your childhood that you struggle with. You kind of get stuck with it, right? And you just need help processing it. And your family and friends can help you process so much to where after a while it may start to weigh on them too, right? So sometimes we need that extra help to also preserve our relationships, right? Because I think we've all had that experience where, we were talking to someone and they were just really struggling with something. And you're just like, I don't know. Like, I don't know what to tell them anymore. Or they've just talked about it so much, they've burned out themselves. They've burned out this relationship and that relationship because people just don't know how to help them anymore. So sometimes, even though we have really healthy relationships, if something happens, then that's when we need a little extra help. Just like with anything else. Like if you have a cold, for the most part, you're going to try to treat your cold at home, right? You're going to try to take some medicine. You're going to get some rest, eat some chicken soup, whatever that is. But after a while, if that cold persists and persists and persists, you're going to have to go to the doctor.
Yeah, but I think, and it says like me and him. So for, let's say if the relationship we have, let's say if the thing is lingering around, right? It's the same bullshit over and over again. Like, man, get over it, bro. I mean, I didn't think the way we communicate with each other, I think in a manly, competitive ways, I guess, it's just like, okay, what you gonna do about it? What can you do about it? It's two things: either you move on, or or you go back to that same old thing. So therefore, keep it on and on and on. I already tell you, okay, you wanted my opinion, I tell you my opinion, and then if you like, I'm right there for you. But at the end of the day, it's up to you now. I think like you said, somebody can do so much, but you have to do the work too. You have to be willing to do the work. Like, okay, how can I start the process and just moving on? But if you're stuck to it, therefore you don't want to move on. So if you don't want to move on, I guess, I don't think a therapist can help you. I don't think it's...
Well, it's a collaborative effort, right? So that's the other aspect of what I do is challenge, right? So if you're having, and sometimes, the timetable for different things, whether it be grief or, depression, that timeline is different for everybody. So there may be times where, like when you say like, oh, like just move on, that might not be what that person needs at that time. So they may need somebody that's just gonna sit with them in it and be like, okay, like let's hear it. And hear them tell it again and again and again, because that's the way that they're processing it. There's gonna be other times where, somebody's in session and I'll be like, I'm gonna have to challenge you on that, right? Because they say something that's maybe some negative, some thinking that's unhealthy. Or if it's couples therapy, or I've done therapy with parents and children, and there's something where it's like, well, wait, I'm gonna have to challenge you on that. Like, let's talk about that a little bit. Where did that come from? So those things are other aspects of therapy, the challenging aspects where if your friends will be like, okay, well, you just, like get over it. But sometimes that person just can't. And that's where somebody like me enters the picture. Because it's like you said, you could either get over it or just keep dealing with it. Or you could go to therapy to learn how to deal with it and not get in that situation again.
But you don't think some people just like a pity party? They just use it as an excuse to just get that like attention from other people?
Well, even if somebody's in a pity party and they need that attention, why do they need that attention? Where does that need for attention come from?
So that's where you come in?
Exactly. But just to touch up on that, and then that's gonna be the last question I kind of ask you about our relationship or whatever. But me and him, I feel like our relationship is in a sense is special in a way. It's because I'm not gonna claim I'm the most honest person that I ever lived, but I try to be as honest as I can be. So therefore, whenever the situation I'm living in, I tend to look at it in my mind as what it is, not what I hope or wish it would be, but what it is. And then when I communicate it to him, I give him the whole 9 yards. This is where I'm at. This is what I wish it would be, but that's where I'm at. To where he can tell me, okay, from where you at and all the resources you got around you, you can do this, and that to get to that point. Or you don't have the resources, let it go. And then like when somebody can put something verbally so plainly in front of me like that, to where I feel like all it would need is logical, perhaps like emotional intelligence to understand yes, it hurt to let that go. Yes, it hurt, but the points are in front of me where I wish like, let's just say if I tell them, hey, man, I wish you fly like Superman. If the man explain to me, hey, man, in the history of human being, nobody ever flew. You cannot fly. You cannot defy gravity. That's just to give you an example. To a sense, even though I wish I could fly, but I'd accept all the facts that's in front of me. I feel like I got that emotional intelligence to understand, yes, this is what I wish or want desperately or badly, but that's where I'm at. And I feel like I got that intelligence to be able to move on. Because I feel like whatever issue I brought to him or he brought to me in that sense, I know he got that common sense to understand once they give me all the details. Not what you want to tell me, but you're not telling me that part, the whole 9 yards. So you give me all the deal, all the ingredients I need to work with to where I can tell you my point of view of things. And then for the most part, the fact that I don't have no skin in the game, no emotion attached to it, I can give you the logical path to it. And then I feel like we've had that relationship to where it's kind of like, if he says it, because I know he's going to tell me the truth. I told him my truth, and he's going to tell me the truth. He's something I can trust. And I feel like that trust we got within the both of us helped me count on what he's saying to move on past my emotion, past what I wish it would have, could have, should have been, and moved on. And I feel like that's what make, I guess, in a sense, our relationship, I guess you may say, special. But that's the last question I'm going to ask in that matter, because our relationship is really strong. To where it's like people that dated us always feel like, why don't y'all go date each other?
Right.
But
well, and I think that's the thing. That's a blessing, right? That you guys have that, but not everybody has that.
Yeah.
So you have to realize too, like how fortunate you are to have that kind of relationship, but not everyone has that. And to use your Superman example, right? Like if somebody was like, I want to fly, I want to be like Superman, like, okay, you could tell you, oh, you can't do it. You'd be like, okay. But what if someone was so obsessed with that ideal they couldn't think of anything else, right? They're like, but I have to be able to fly like Superman. So the therapeutic question is, okay, why is that important to you? Where is that so important to where you're starting, it affects your quality of life to be able to want to pursue that and fly like Superman? Like, let's dig into that, right? That's the therapeutic question when we come to that, if we're using that example.
But I feel like we do that in a sense. But let's say something like this. He tell me he think he can fly. So I mean, like, where you get that idea from? He say, you come on, where that idea from? So I'm like, you can't fly. He said, man, I can't fly. All right, let's get on top of this. You're gonna fall. Eventually, I think that's what we have. Like, okay, you want to put it to the test. You feel like you can fly. Whatever you come with your engine and stuff. Impress me, show me.
But I feel like, and also we know each other so much in a sense to where it's kind of like whenever I bring some stupid idea, before I even tell him where it came from, he can put it together and realize where it came from.
Yeah, you know?
But like I said, just to move on, because we got like so much that we want to debate, we're not going to linger too much on that, at least not for me. I don't know if you got any more questions you want to ask in that matter. But the other type of question actually I wanted to ask you was depression. In 2024, that's like a keyword, depression.
Yeah.
And give me your understanding of depression to where I can understand if it matches.
And before we even answer, because I want to speak how I understand depression.
But let her speak. She's a professional. So let the
I think in a sense, I think I want to hear what she got to say.
That's what I'm saying.
But I want to hear.
No, let her speak first.
Okay, go ahead.
Because at the end of the day, she went to school for that. It's like she knows what she's talking about. Like us, we're idiots who just got opinions.
Okay.
So therefore, let her discuss it first.
Opinions matter.
Yeah.
Okay.
Well, depression, you think of it as there's feeling sad, right? And there's feeling depressed, and then there's clinical depression, right? So those are different things. And when we talk about a diagnosis of depression, it's a set of symptoms that have a certain level of intensity over a sustained period of time that affect your quality of life. So say you go through a breakup and you spend like 2 or 3 days like in your room, eating ice cream, watching sad movies, crying, right? Like you feel depressed, right? If that extends to where you're not going to work, you're not going to school, you're not interacting with people, and this is over a period of 6 months, then we may need to look at, okay, like, is this a clinical depression, right? So there are times when people feel depressed. There are times when people feel sad, especially if there are things like grief or even, things that are traumatic. But if it extends past a certain period and it's affecting your quality of life, that's when you want to look into getting help, whether that be therapy or if there's some sort of chemical imbalance, there may be medication that can help. or there may be a situation where a medication can kind of give you a jump start, and then therapy come alongside that to work more long term.
So, but let me so my question is, and I understand everything you said. This is where I have a problem, me personally. So, I'm on piggybacking from what you said. So let's say you go through a breakup and you decide to stay in the room. Well, this is where I say sometimes as human we're careless about how powerful the brain is, right? So you just start to stay in the room for 3 days, eating ice cream, being sad. Cool. So now you're learning a new pattern that you're not used to. So then it passed a week, you stay in that room. 2 weeks, you stay in that room. Because when you're being depressed, something is depressing you. So that's mean it's the breakup. So therefore is do something else, right? It's not easy. I'm not gonna tell you it's not an easy thing. The pain is hard. You're going through a lot of stuff. But if you stay in that state at a long period of time, that's gonna become you. And then that's when you put yourself in a hole. So therefore I don't think you could needed a therapist to help you get that. But if you're not self-aware of the situation you're putting yourself in, that's when you end up being depressed, and then you end up being taking like medication. I think that's really a bad thing, because therefore is when you put somebody on medication, they never really deal with the situation, because if you're being depressed, you have to deal with it. Put you on the medication, all it does is numb the pain. And if you don't go through the pain, and it's gonna linger on around, and it's never gonna go away. So am I right or am I wrong?
Well, when you talk about medication, it's not just about numbing pain. It's more about dealing with the receptors in your brain and how they accept neurotransmitters and stuff like that. Because sometimes depression is related to an actual chemical imbalance. So for things like that, medication does help, just like it would help with diabetes, or it would help with allergies, or, there are certain components that we have in our bodies where things maybe work a little differently. And that's why we have to take medication to deal with that, right? So it's the same thing with the brain. Your brain is part of your body just like anything else, right? And depression, things like bipolar, those are illnesses that affect the brain, just like you have illnesses that affect your kidneys, your lungs.
Sorry to interrupt, do you feel like that's something that could be like genetically connected in a sense?
Sometimes, yeah. Sometimes it can be genetically connected. Sometimes it could also be an event, something that happens to you, right? And in those cases, like therapy can be very helpful. I think therapy can be helpful whether it's genetic or not, because it gives someone an outlet to sort of discuss what's going on and that extra support. Just like any other illness you have, right? Even if you get treated, there are sometimes you need additional support in addition to the medication or the treatment or the surgery that you're having to treat the illness.
You don't feel like to me, feeling depressed is real.
It's what?
Feeling depressed is real. It's a real thing. But depression as a clinical disease, I don't think is a real thing.
And before you answer that, I gotta put more details behind it so you can see where we're coming from. We grew up in Haiti, and growing up in Haiti, the only thing I knew, me personally, is either you're crazy or you're sane, and nothing in between. So there's no depression. I got stress. I got bills. No one cares. If it bothers you so much, well, go live in the street.
Right.
So that's how we looked at it. There's no gray area in between. It's black or white. And then what we mean by that is, just to touch up on that example that you gave earlier with the relationship or broke up or whatever. Let's just say if I'd call him and be like, hey man, so-and-so broke up with me. I'm sad. I'm this. I want to kill myself and this. I want her back on the whole 9 yards. Knowing him, you know what the answer would be? Okay, if you want her back and she don't want you, I'm going to tell you the options you got. You can kidnap her and tie her up to a basement, go stalk her like a creep, or do some creepy stuff. Are you willing to do all these three things? And of course, him knowing me would be like, nah, I'm not doing none of that. So if you can't do none of that, then I mean you got to accept it. And I feel like the fact that he would be able to put it up like that was because that's how we talk with each other, as direct as possible. So therefore, if you can't do none of that, you only got one option left, the hardest one, let it go. And when somebody can put stuff like that within detail that know you so well like that and paint the picture so well, it doesn't matter how stuck you were, like how deep you were, at least for me, and how deep you were within the rabbit hole. So when somebody gives you, okay, you're not happy with this is the options you got.
Right.
Which one you want to do? And then when you realize there's options or something that you're not or something you're not willing to do, to where you start looking at letting it go or move past it in a different light. That's the relationship we got. It's simple, it's direct, it's straight to the point, and then we move on. But that's where we're coming from when we like depression is not something we can take real. I know a lot of people are gonna disagree, because me personally, if I'm going to something, I'm gonna go for a run. And like what I mean by that, I know when I'm running and my lungs are gasping for air, the last thing I'm gonna be thinking is other issues, because it's like in my mind just switch gear. Okay, screw that problem. Now we need to find a way to keep air going to his lungs. And then whenever I do that, and if I do it long, not even long enough, when the moment it's like I can find a way to make my mind switch gear, it's kind of like my mind don't even value that problem anymore. That was not even a real problem. And so therefore, like a lot of time, you be calling me, I'm like, hey man, I got a lot going on with this or whatever going on, I'm gonna go for a run. He knows that. And it's just because that's what I do. Because I know if I find a way to distract myself, I go play video games, something too I can just switch gear within my brain. Because if you think about it, that's what people do with liquor, like weed, whatever drug they're into. If they find a way to distract the mind. But I feel like for me, that's how I can distract my mind. But within your perspective, in two ways questions, what makes depression real within the eyes of most people? And two, do you feel like the result, the way we attack it is accurate or good enough?
Yeah. Well, it's real because there's, clinical research, right? There's research cases that support that it's a real thing. And I would challenge you guys on this because you're coming from a perspective of two people that have had a certain level of support, right? So what if you were going through all those things you were going through, but you didn't have him? You didn't have anybody to rely on. It was just those feelings and those emotions and that depression, and you didn't have anybody in your life to come and talk to you and tell you. And that's part of what people go through. Not everyone has this
dynamic.
sort of
I understand
dynamic,
that.
right? So you're sort of coming from, for lack of a better word, a perspective of privilege in that you have a really healthy relationship, you have a really healthy support system, and somebody that's going to be there for you. And it's a wonderful thing, but not everybody has that. And when you talk about something like a clinical depression, think of it as like any other aspect of your body. Like I have asthma. So it would be like if I had an asthma attack right now and I'm having trouble, and I'm starting to wheeze, you would be like, just breathe. It's the real thing. Just breathe. And I'm like, I can't breathe. Right? So there are some things when people are dealing with depression or anxiety, you're sitting there telling them, just be okay. And they're like, I can't just be okay. I need help, right? And to do that, especially in a climate where not everybody understands that, is a really brave thing to do. To reach out and say, hey, I need help with this because I don't necessarily have the support system in place that other people
Okay, but you think I know somebody. So they had going, so let's say nowadays it's easy. I'm not he's a conspiracy theorist because I'm a guy, but I know they got those companies where they make a lot of money with the selling, those low pills and stuff like that.
like big pharma.
Big pharmas and stuff. But I feel like something like to go through a breakup, couldn't take it, handle it really well, starts doing some crazy stuff, right? Throwing shit out, go places and, couldn't deal with it. They didn't have the super system that we had. And first thing is now, the diagnosis is you're crazy, but nobody really asking them what's going on. So then now you put them on medication. That's the first thing you do, right? And they had no way to deal with it. Now the pain is still lingering around. They never go through it. So now it's working around like a zombie. So is that the right thing to do? That's kind of, to me, that's a lot of times that's what
It feels wrong.
they do, instead of really helping you the problem, but they give you those
They
medication.
just drug you up. They just find a way to distract your brain in a sense from it, I guess.
Yeah, well, and I've had a lot of clients that come in and say, I just don't like the way this medication makes me feel or it makes me feel numb. But I think that my personal opinion, is that medication should be accompanied by therapy. Because yes, there's a part where it's medically necessary that you need medication, but I think it should be accompanied with therapy to help give you skills, right, and tools that you can use so that when you start feeling depressed, you're like, okay, I know I can do this. I know I can run. I know I can talk to my cousin. I know I can do, because what you have, when you say that, right, when you're talking to your cousin, when you're running, that's your toolbox, right? Not everybody has a toolbox. So I think that medication therapy should be accompanied by some sort of talk therapy that's going to give you tools to use to address whatever's coming up in addition to the medication. Because medication is one aspect of treatment. The thing about counseling, like there's medical models that social workers and things tend to get trained more in a medical model. As a counselor, I get trained more in a holistic model. So it's about, okay, medication, therapy, maybe there's some body movement practices that you can do, because we know from research and studying that you carry trauma and you carry these symptoms in your body. So sometimes body movement helps.
Yeah.
So those different aspects in a holistic treatment plan to help accompany the medication, and hopefully maybe if you can get treated, sometimes people have to have it because it's a condition that's part of the way that their brain is structured. But sometimes people after a while can get off the medication because they're like, I feel like I have tools now.
But I mean, sometimes you don't feel like some of those medications are really addictive, in the sense that people, whenever
feel
time
like that's a go-to for every problem.
for every problem they got, it's easy to just, instead of like dealing with the problem, and then I just take the medication and numb myself and I'm good.
Well, I think that's why it's important to go to specialists, because right now there are different types of clinicians that can prescribe. I think that if you go to someone that's a specialist, like a psychiatrist, someone that's studied those specific things, there are hopefully things that they're going to put into place to guard against that and to make adjustments as necessary, right? Because sometimes people, like say if you have postpartum depression, you may not need medication for the rest of your life because you're dealing with a certain aspect of life, right? So you get some therapy to help you manage the feelings, and then you have some medication to help your readjust, because there's hormones, there's all kinds of things happening with your brain and your body that are different from what it was before, right? So I think that there's different aspects of that. I think that if you go to someone that has specialized training in it, hopefully there's less likelihood. Do I think sometimes medication gets overprescribed? Yes. I feel the same way, though, about any type of medication, not just psychiatric medication. I think antibiotics probably get overprescribed a little bit. I think, there's a lot of things that maybe sometimes get overprescribed. But it's up to us, I think, to seek those other type of therapies to accompany medicine.
But you don't think sometimes people use depression as a way of,
Like an excuse?
is
in
an
a way,
excuse
or
because of
something?
their laziness, and they just don't want to do nothing with their life, and they use, because I didn't do this because I've been depressed.
No, I can't think that way as a therapist, because as a therapist, my job is to do no harm. So if somebody comes in and say they're depressed, I have to take all of that seriously. Because when we don't, in my profession, if you don't take that seriously and somebody really is depressed and they end up hurting themselves, that's,
Yeah, but I mean, I'm just saying that
dangerous.
I understand this, but I feel like sometimes a lot of people, like, to go back to, I feel like it's like pity party. Like, you just say, cool. Let's say if he's telling me right now, man, I'm depressed. Mm-hmm. Cool. Why? Because when you say you're depressed, there is something depressing you. Mm-hmm. What is it? Man, I'm broke. Get a job. All right, my girl leave me. Get another girl. You know what I'm saying? I think like there's so many things you can.
I think she can relate to
like
that.
that's
We feel direct with one another, and that's why I feel like we got to watch out to what we don't sound ignorant. Because I feel like, in a sense, people that don't quite know us are gonna make it seem like, or people that's like actually dealing with depression are gonna look at us as if y'all ignorant, y'all just don't know. But in a sense, speaking of toolbox, I had a teacher way back in Haiti, and I remember when I told him that, he was like, man, that makes complete sense. A teacher back in Haiti that used to tell me, whatever it is you're dealing right now, think about your future self 2-3 years from now that's going to look back on that problem as something that is so irrelevant. He says, think about it. When you were 5, if they take a toy from you, you're going to roll down on the ground crying. When you were 10 or 12, that little neighbor girl you had a crush on, you saw her kissing somebody else, you were heartbroken. Now, at that time I was like 14. He said, well, now you're 14. And the way he worded it made so much sense to me, to where it's kind of like, even when I'm dealing with something, it's kind of like in the back of my mind, I tell myself, 3-4 years from now, that won't be a big deal. So therefore, let me try to figure out what makes 3 years, like my 3-year future self from now, see it differently and seek it that way. Instead of crying and complaining, I'm like, I know, we all know once you get in the future, time heals all wounds, or as they say it. Once I get within that future, I'm going to be able to look back and be like, that wasn't even that deep. I don't even know why I acted like that. So instead of crying and complaining and reacting, within the back of my mind, I'm like, okay, let's find a solution to that problem. There's two solutions. It's either you accept that problem, or you find a way to do something about it. Because that's two sort of problems in the world. I don't think they got like a third type. It's two types. And I feel like our directness sometimes get misunderstood. Because we're so direct to one another. It's like I feel like when somebody's saying something that makes complete sense, you should be able to have like the awareness, the knowledge, the understanding, the emotional intelligence to see it, to be able to remove your emotion out of it and see what they're saying. Like you were saying, you broke, get a job. It's just that simple. Because I promise you, Santa Claus is not gonna knock on your door and give you a check.
Right.
Because it's that simple. But I'm gonna let you go.
Well, that's the thing. Like it kind of sounds like an oversimplification of a multi-layered thing, right? Because depression isn't always just about not getting a job. Sometimes it's not having a job, but childhood trauma, and I don't know how to deal with it because I was socialized or raised to not process emotions. So I have these sad feelings coming up, but I don't have an outlet for that. And I don't know what to do with these emotions. And so what we don't have the capacity or we don't have the know-how to emotionally regulate, things tend to implode, right? And that's when we have, because anxiety, depression, all those things, that's paired with this feeling of being alone in it and not being able to connect with people that understand where you're going through. So if you have someone that comes up to you guys with depression, you're like, just get a job. That's another misconnection for that person, right? That's an opportunity where they weren't supported and they're like, all right, yeah, I am alone because they don't understand. They don't know what this is like.
Yeah, but you know what? I mean, I'm
That's the only source of money. Seeking somebody that's going to tell you the right thing.
Related to depression, because like you're like, oh, just get a job. Okay, so what if this guy was like, I've been applying for jobs. I've applied for 50 jobs. I haven't gotten any of them.
75 now. Go for 75.
I did 75. Now what?
Go to 100.
I did 100. Now what? You see what I'm saying? Like, there's only so far where we could go where it's just like,
you guys,
that messed up.
you know, but again, okay, so what you were talking about with the friend, right? So when you're friends, like you say that kind of thing, that's where I enter in because I am naturally an empathic person, but I also have trained in skills of empathy. So when somebody comes in with depression, no, I can't say, oh, okay, like just do this, just do that. My job, like my profession, my calling is to get in there with you and sit in it with you and figure out what's the root of it, what's causing it. Like, tell me about what happened. What's going on in your life right now. And so my job is to take all of these things that you tell me, like threads, and sort of start to weave a picture. And as I started to understand the picture, to say, okay, so I think this is where all this stuff is connecting, and start pointing that out to you. And you're like, okay, yeah, that can be why I'm feeling like this. And then we're like, okay, so now we know the why. Let's try to figure out skills that we can use and build to where when these feelings come up again, you can manage them.
Okay, let me. So to me, expressing my feelings in a lot of ways can be a sign of weakness. So I can allow myself to do it.
Therapy could help with that.
But I feel like it's just like with him, so it's okay to show those weaknesses. But so let's say like, I felt like over the years, like the last 2 years, I went through the worst, just a little bit part of my life, like, with most painful way. But I blame myself because at the end of the day, I always do self-diagnostic, like, see what did I do wrong. So sometimes I felt like, okay, I was being careless with my emotions and feelings and stuff like that. So now I put myself in a hole that it's hard to deal with it. The pain was hard, right? It was very painful. But and then over the years, I realized, man, when I talked to him, he's like, when he told me about what the teacher said, I look at myself, yeah, you're right. 2 years from now, I'll be like, shit, I don't even know what I thought that way. But therefore is I had to like, because it's programming, right? Every day you're being programmed to something, right? Just like social media, just like watching TV, watching the news, you program yourself. You can reprogram yourself to a different situation in different ways, right? So to me, it's like I say, expressing yourself is a sign of, a weakness that I felt like I don't have to explain to people what I'm going through. So if I'm going through something, if you say, hey man, you're tripping. All right, cool. So I'm gonna go self-inward and figure out why am I tripping about it. So, and then I realized over the years, too, the last 2 years, it's okay to feel pain is part of life. I think that's why misconception about, oh, we're not supposed to go through pain, or you're not supposed to go to struggles. I think it's part of, I don't know where if it is a thing that they teaching people like, oh man, you're not to deal with like pain is not okay. I think pain is in a way that's just like when you get hurt, like if I hit myself right now, pinch myself and I feel the pain, it's just showing there is something is wrong. So when you go into whatever the pain is, you can deal with it. I don't think you need, to me personally, even though let's say I didn't have them, I think I'm self-aware enough to be like, it's okay to feel those emotions. It's okay to feel pain. It's okay to be happy. It's okay to, all those emotions is part of who I am.
And, and seeing, we not know us, but having the chance to speak in front of a therapist, and I guess you may say exposing ourselves to a sense, I'm sure in a sense to her, she remember like, hey, those guys are ignorant, like, because we don't fully understand emotions or whatever. But the truth of the matter is, that's, I guess, if you go way back within our background, that's how we grew up. Like, especially, like, if you think within the black community, they don't value emotions or whatever, in Haiti, it's about 100 times worse. Because think about it, it's a third world country to where everybody wake up on a daily basis and trying to wonder what they're going to eat for the day. That's the biggest problem for the day.
You don't have the luxury of
So
expressing.
exactly,
Yes.
it's like they don't have the luxury to worry about anything else. To in a sense, that's kind of like, in a sense, how we grew up. To where it's kind of like, whenever I can see depression or whatever it is creeping in or whatever, I just sit back and look at my life and everything too. I'm like, man, this is not that deep. Because, I don't know if anybody else ever find themselves in a situation when they had a problem, they're stressing about it, and the bigger problem show up. And then you realize that problem wasn't even a problem worth worrying about. And in a sense, it's kind of like whenever it happened, within a split of, like, when the moment when I find myself losing control, it's kind of like I got this sixth sense, per se, to step back from the situation and say, okay, that's what we got, that's what we're going through. And then rarely it overwhelms me to where I got to call him, rarely. But for the most part, I feel like I can handle it. And it's because I feel like, okay, I can put logical thought beyond this and make some sort of sense out of it before I let emotion drive me over the edge, over something that ain't nothing. And the thing is, I think somebody had said something, I forgot where I read this from. He says that logical thinking, we all got it. We just don't know how to get it. And he says, think about it. If somebody go out there and do something stupid and go to jail, the moment they find themselves in that jail cell looking at the wall, they for some reason, all that logic come back within them. To where they're thinking about, man, I shouldn't have done that. That was stupid. So therefore, I feel like that logic is somewhat, that sense of finding a way to solve the problem before it get out of hand is within you. But I feel like, but like I said, it's just an opinion. I feel like most people don't have that sense to pull it out of them. So in your personal experience, like, what would you say on that matter?
Well, I think, we all have logic, of course, that walks hand in hand with emotion. I think sometimes, particularly men, are socialized to stress logic more than emotion. However, being able to express emotions is one of the healthiest, bravest things we can do. It's a very natural thing to do. Think about it. When we're born, what's the first thing we do when we're born?
Cry.
We cry. We express emotion. It's one of the most basic, natural things that we do. We don't come out and say, I logically am grateful to be here. Right? We don't say that. We express emotion because when a baby is born, they're overwhelmed. They're coming from the womb into this cold, bright room with a lot of noise. And so they're overwhelmed, and they learn first off to express emotion, to let people know that I'm overwhelmed. That is a very natural thing to do. It's part of our makeup. So when we restrict that, and when we don't allow ourselves to do that, there are issues that come from that restriction. Because what happens, we don't learn how to regulate those emotions. What that baby is doing when he or she is crying is regulating their emotions. They're starting right away. They're overwhelmed, and they cry as a way to regulate these overwhelming feelings. So when we don't do that, or when we're socialized to not do that, it's going against our nature. And so issues can arise from that. We don't learn how to regulate those emotions. and it comes out in other ways, whether that be repression, like, oh, okay, it's not. And sometimes it's not. Sometimes there's perspective, right, that you gain from experience. Sometimes it's repression. It's repressing those emotions because we're not supposed to have them. We're not supposed to deal with them. And then what happens with that eventually when people come to counseling sometimes is that it boils over and it's not working anymore. Repressing them is not working anymore. Doing this or that to deal with it is not working anymore. So people come into counseling because whatever they've been doing to get them to that point and whatever you were doing worked up to a certain point, it's not working anymore.
But you think showing emotions, express your emotion is not a sign of weakness?
Absolutely
honestly, I disagree with them on that. It's on this one. I wouldn't call it weakness, showing emotion. I wouldn't call it
I mean, that
weakness
to
at all.
everybody, though.
Like, if you're doing it to everybody, yeah, it gets to a sense where it's pathetic, but I wouldn't call it weakness in a sense. But the where I'm coming from is emotions. Because if you think about the people that's like extremely depressed, that got mental health issues, that go shoot up public places, to them, they're reacting towards an emotion. You know, the people that are willing to fight a random person in a bar because that person just bumped their shoulders, that's a sign of emotion. And then at the end of the day, and I got a personal story of somebody I knew. I didn't know him that well, but I worked with him, who went to a bar, got into a fist fight, punched somebody, and the guy hit the corner of the bar on the way down, busted his head open, and went to jail. It's just one of those emotional reactions. And and it's one of those things to where it's kind of like, yes, emotions are normal. That's what makes us human. But it gets to a sense, I feel like if you got some sort of intelligence or emotional intelligence, I like to call it, to where you got to realize not everything needs a reaction. To a certain thing before you react, you think first. Like emotions say, do this, and then you stop and be like, okay, if I do this, what's the worst that can happen? And then once you can see, okay, this is the worst, and I'm not okay with the worst, at least for me, that's how my mind works. This is the worst that could happen, and I know I'm not going to be able to handle that worst, and then that allow me to retract my emotion right then and there and use logical sense to deal with it. But
okay, so all those examples that we're using, if I'm remembering the examples correctly, they weren't expressing emotions, they were expressing one emotion.
Yeah.
Anger, right? And what we know about anger is that anger is a secondary emotion. And so a lot of times what we're socialized to do is that all those other emotions that we have is like, to say I'm hurt, frustrated, you know, like that's like if you know, like another man comes to be like, you really hurt me. You'd be like, oh, man. Right? Look at the face. The face that you made, you were like, disgust. Right? So what happens is that when we're not allowed to express this range of emotions, the only safe one to express is anger. And that's what you're seeing.
But I gotta
because I guarantee
I
you
gotta respectfully disagree on this.
Okay, let me give me.
Okay,
Let me cook. Okay, so how many times? Okay, so when someone expresses emotion, I can almost guarantee you that's not the only emotion that's like nobody, like people generally speaking, like I'm not gonna wake up in the morning and suddenly become a person that's gonna become violent, right? And usually what happens to what you're describing, those examples that you use, there was something that boiled up to that.
Yeah.
Right? That doesn't come out of the blue. That doesn't come out of nowhere. There's a lot of emotions involved in that. And there's a lot of emotions. If you look at a lot of those stories, you start looking at the background, there was probably a lot of stuff going on that they weren't able to learn how to express or emotionally regulate. And the only thing that a lot of times, especially men, are allowed to express is anger. That's an acceptable emotion, right? Like if somebody, okay, you know how you used to like when you're kids, like you would do this thing where you would talk about each other, right? Like you'd be like, your mama's so fat.
Yeah.
Like, right? But what would eventually happen, right?
A
fight eventually happens, right? Because somebody says something nobody wants to admit. You touched a nerve or you hurt that person's feelings because you're talking about their mama. And the reaction is not, hey, you know what, you went too far. That hurt my feelings. The reaction is,
nobody gonna do that.
right. But what I'm saying is that, remember what we just said, right? We use the example of a baby, our very essential nature. They know how to express a range of emotions. That kind of reaction It's not a natural reaction. That's a socialized reaction.
But okay,
But I mean, I'm just saying.
I gotta touch up on this point though, because she kind of said something maybe forgive me if I misunderstood you. You said like when people withheld an emotion, it balled up and then releasing it in a sense of anger. You understand? You're right. And I guess in my personal opinion or within my personal lifestyle, I respectfully disagree. It's because to find something that pressed my button, it's gotta be hard because I feel like I always say I live within the comfort of my truth. It's because before you attack that button, I knew it was there and I pressed it 1,000 times myself till I got over it. At least that's how I feel like I live my life.
Well, but also to go back to what we said before, you're coming from a perspective of somebody that has a support system. You have people to talk to. Like you have support. What about people that don't have that?
Yeah, I guess that makes sense. But in a
Okay, so let's say, for
I've never
instance,
seen somebody try to push your button. Like they know, okay, this button gonna make him react this way, and then they didn't get no reaction out of you, and then that make them mad.
Yeah, because they're working to get a reaction out of you. But for the person that's not having a reaction, it could be that they're regulating their emotions, right? And they're like, oh, obviously this person's trying to get a reaction out of me. I'm not going to give that to them. They're regulating as that's happening. Or it's somebody that's just repressing those emotions. And you can see that because you've seen, I mean, you've seen on social media or whatever, where somebody's pushing their button and they're like this, and all of a sudden, what do?
Jump on them.
Jump on it.
I mean,
right?
sometimes too, I think our makeup, we like as human, we like the drama. Like, so you're gonna let them talk to you like this? Or so you're not gonna do nothing about it? And sometimes that can push somebody to have an emotional reaction.
Just to show you what you're saying right now, because a lot of time, like especially for me or for him, like you know when somebody says, "Oh, so you're gonna let him talk to you like this?" Or if you don't do this, that makes you a P word or whatever. That makes you a B word or whatever. And the thing is, like let's just say if I try to do this to him, or if he's trying to do it to me, or somebody else trying to do it to me, I'll be the first one to admit, yes, I guess I'm a B word because I'm not doing it, and I'll be okay with saying it. That's what I'm saying by finding comfort within my skin because I know I'm not doing it. What makes you think I'm gonna go ahead and try to do something? For example, I work within the refinery, and they got raccoons everywhere. I don't mess with raccoons, and then. When I see them dudes, I don't care if they're a million miles away, I walk the other direction. That's me. And they're like, man, you scared of a raccoon? Yes, sir, I am. Yeah. Oh, man, it's a little raccoon. Man, they're not going to attack you. Man, I don't care. I'm just scared of a raccoon, and I'm cool with it. And then that's the part of coming within the comfortability of being who I am. You can say whatever the heck you want. I just know I am scared of them. I don't care what that makes you think of me. But I just know I am scared of them, and I own it. Now I'm gonna go like whatever that makes you in your mind, or whatever that makes me in your mind, I'm perfectly fine with it.
Well, but again, you're coming from the perspective of someone who, like, through this whole conversation, has been able to list all kinds of tools that you have in your toolbox to be able to use to regulate. And if somebody says that, you can like, oh, I can, because you've learned to regulate your emotions because you've developed tools. But you're coming from the perspective of someone that has developed tools. Not everybody has had that.
But the thing is, what makes us think,
life.
like, what, and I guess we got a hard background. I guess that's the only thing I can relate to what makes us think like that. And I remember me personally, I've used to hear my mom telling me on a daily basis, as cold as it may sound, she used to tell me, if somebody drop dead or win the lottery tomorrow, that's the best thing that could possibly happen to them. If that won't affect your life in no way, shape, or form, what makes you think their opinion should matter to you? Because I remember I used to come home as a kid and tell my mom such and such kid made fun of my shoes or something, buy me some other shoes or whatever. Like as a kid, or such and such kid got this game, I want this game too or whatever. And she used to tell me, hey, if that person win the lottery tomorrow or drop dead, which is the best two things that could possibly happen to a human being on this earth, if those two little things would not affect you to where you won't get a dime from that lottery money, or you won't shed a tear if they passed away, what in between should matter? And I remember in my mind it made sense.
Right, but your mom, in that instance, is giving you tools.
Yeah.
Right, she's giving you perspective, she's giving you tools. What if instead your mom wasn't there? Or if instead you went to your mom and she was like, stop being a little bee, and slapped you across the head?
Yeah.
You see, like, that's a very different perspective, but that's something that happens, right? Is that when you had a mom that was caring enough to instill, to give you tools, to give you ways to regulate, and to give you perspective on how to look at situations, but not everybody has that.
Well, let me ask you this. So do you think like they should have a ways to teach kids that in school?
Like in a way to toughen the mind.
Oh, absolutely. Yeah, actually, one of the, with my nonprofit, that was something that we did. We would actually go into a local school and do social emotional learning classes with the kids.
But that's something they should put in the curriculum, like
I agree.
And then another things I feel like in school is, for instance, one of the teacher called me and said, "Hey man, we need to put your kids on medication." I said, "Hell no, my son is just active. He's just using his brain, like he's exploring, he's trying to figure it out. I put him in this world, so he's trying to figure the things out. So because you can't deal with it, you feel like you need to put him classify him as ADHD and put him medication. But I feel like a lot of times they do that here to numb the kids, to stop them from make them become a zombie. Then now they grew up, they need those medication, and then when they don't have that, they don't have to deal with situation. And I think that's why we end up with school shooters. Am I wrong?
Well, I think it's more multi-layered for something like a school shooting. But I do think that there is, I do wish in our school system they did allow more activity, more physical activity for kids. Because like when I was growing up, I don't even think people really I don't even know if ADHD was a diagnosis yet. I mean, but at the same time, we were allowed to do a lot of physical things to discharge the energy that we had, right? And there's something to be said there's a lot of research actually on the importance of play for both kids and adults actually, and how important it is for your mental health and your physical health to be able to play. And I think that's something that we've lost a little bit in our schools. Like I remember having recess and being able to play for 30 minutes maybe? I think now it's 10.
Yeah.
Yeah, I think there's 10 minutes for recess, and then maybe kids have 20 minutes to gobble down lunch. And I remember having an hour for lunch when I was in school. So there's those things.
Yeah. So let me.
It might not have been that long, but we had a minute.
But do you feel like this generation that's right now is become soft in a way?
I think this generation has become more empathetic, which I think is a wonderful thing. I'm not gonna use
There's a
empathy.
difference in between empathetic and being soft.
I mean, but you also said something about emotions being weak. So.
But that's he said that. Not me.
The reason I'm saying because, okay, so showing your emotion, do some stupid crazy shit because you was being emotional, like you wasn't stable emotionally. Somebody pushed you to do some stupid stuff. That's weakness. So that's therefore is what he's strong enough, he regulated his emotion, he know how to control it. So therefore when somebody come and trying to play with his emotions, he's strong enough to say, no, I'm not doing that. Well, see, but some people, so let's say when I say weakness, so therefore if somebody come and can play with your mind, say you, oh man, do this, oh man, control you, because some people they want to fit in. They don't have no friends. They want to be like everything. Like so many times I see it in the job, like people come in and they start talking about him. You don't even know him. And you started come up with stories too, just so you can be in the conversation. So that's people they got a lot of those people that don't have a good support system like we have. So therefore if somebody come and say some bullshit, I don't have to hear your bullshit because at the end of the day, I don't need to be your friend. We don't have to be friends because I got enough friends and I got my support system is legit. So therefore, I don't have to do this stuff. So that make me mentally strong. So therefore, I can control my emotion better than some other people. That where I come from when I say weakness.
The younger generation is a bit more sensitive. That's why I feel like empathy is. Let's just say somebody walks in right now and can tell me a terrible news. They just lost their mother or something in that sense. You show empathy. But let's just say you meet a rich kid who's mad because his dad bought him a Ferrari, not a Lambo. I cannot show you empathy. You just get tag out of my face with that BS.
Right, but that's two really different things. And I think what you were calling weakness, I call sort of like a gap in skills. So that's like not having the skills of emotional regulation. That's not having the resources of support. So I don't look at it as weakness. I look at it as like, okay, so there are some gaps here that we need to address. There's some gaps in emotional regulation. There's some gaps in support. There's some gaps in his toolbox. Or because sometimes like somebody may want to emotionally regulate, but they don't know how. So I'm looking at that as gaps that we need to address. okay, so we need to look at these things and figure out ways that work for this person to be able to do that.
But don't you think you just use a better words? I feel like just like if I
As
go
a
to the gym,
professional, she
yes,
is like
I feel like because if I go to the gym,
Weakness though implies some sort of personal deficit. What I'm saying is that no, there's just some skills that you weren't taught.
but that's still a deficit.
Well, that's like
though.
saying, okay, so that's like, though we see examples of that in other places, right? So if I can go in and, like you have 2 third graders, right? One third grader can read at a 5th grade level. One third grader could read at a 1st grade level. To your example, you'd be like, you're weak and stupid.
I wouldn't say weak and stupid, but weaker than the 5th grader.
But that's not weak. That's something that they weren't taught. It doesn't mean that the third grader that reads at the 1st grade level doesn't have the ability. They just weren't taught the skills necessary.
But that's a weakness. Does he have?
Make you weaker.
That's a weakness he does.
Yes, bro.
That's what I'm saying.
But the thing is,
We said the same thing.
listen, there's this thing. Ignorance is bliss and knowledge is power. Yes, you can choose to ignore to be happier, and you can just seek to get the knowledge to where you know better and seek it. Let's just say right now, I'm in a situation, right, and I show up to the situation. Let's just say we go to the gym because I work out a whole lot more often than he does, and whenever like we show up to the gym, even though I'm a bit slimmer, I can lift more weight or whatever. And then whenever you show up, and of course, granted, I work out more often than he does, and I can do something with a certain weight he cannot do. To me, dude, you're weak.
It's weakness, isn't it?
To where there's a level to this, and it's kind of like, and the thing is, that don't mean I'm making a false statement. You are weaker than me.
Your muscles are weaker than
Yes,
his.
I mean that's a
it's
weakness.
an accurate
But
statement.
what
So
I'm
therefore,
saying is
if that
that
bothers you,
if somebody is struggling with something or they don't have the ability to emotionally regulate, that doesn't, because to use your analogy, you would be implying that their brain is weaker than yours, which is not necessarily
I
the
wouldn't
case.
say brain. I wouldn't say like in the brain. I'd just say, okay, for example,
Okay, so let's backtrack. What would it be if not the brain?
it's not the brain necessarily. Like I said, within the gym statement that I just used, that means physically. I wouldn't say mentally.
Yeah, but that's
physically.
she was
I'm
talking about the
struggling with that,
mentally
Right. So I
weakness.
was like saying with that analogy,
Yes.
then if somebody is weak, what is it that's weak?
I mean, I'm not saying
that
like
means you got room for improvement.
Man,
It's
your
like
brain is- I mean,
whenever
I
you
can-
find
I can agree
yourself-
with that.
Whenever you find yourself within the
But what's
state,
weak?
your brain is weak. I
Okay,
cannot.
so you're saying somebody.
I
what
can
I'm
say your
saying
brain is weak.
To have a weak brain is to mean what?
I mean that's mean
Brain.
that's mean you got work to do. That's what I'm seeing.
But yeah, I was just joking when I said retarded, but that
You got
means-
work to do.
'cause a lot of time as men, we're competitive, right, or whatever,
Very.
right? And I remember, thing is, naturally, I'm slim, I got long legs, and I've always been known for quote unquote being fast. But I wouldn't say I could compete against Usain Bolt or whatever. And then usually when I race people, it's not even like regular people, of course, because I'm a regular person myself. It's not even comparable. Like growing up, going to college, going to parties. They say, man, you want to race this guy from Haiti? He's fast, race him. And I raced a track star from McNeese, and I made them guys look like they were standing still. And I don't even practice or anything. And then one day, for some odd reason, I came in and across this white, skinny dude that's shaped just like me. And I'm like, man, this dude white, he ain't gonna beat me. Man, like, it didn't beat me by much, but that was the first time me facing a regular civilian that kept up with my speed. And I remember it humbled me. And then within that moment, I realized, okay, there's levels to this game. And that don't mean, like, in a sense, it's like me acknowledging what's in front of me. Because the moment the situation presents itself in front of you, you can see it. There's no denying it anymore. You can tell yourself, you can try to tell yourself whatever it is you want, but right there, it's in front of you. You might, like, let's just say, Usain Bolt at his prime, fastest man alive. And then some random person came out of nowhere and made Usain Bolt look like he was standing still. At that point, okay, there's a level to this game. You right there, and there's a whole new level. Like, even if you're right there, you gotta recognize there is this level. I'm not there. And then by recognizing it, that shows you, okay, if you want to be there, if it bothers you that much, you got work to do. Like when, like as you say, within the third and the fifth grader, if there's a fifth grader that can read like a fifth grader, a fifth grader that cannot read.
A third grader can read like
fifth grader.
Well, it's
first.
two third graders, one
Third
like a
grade.
fifth one.
Yeah, one can read like a fifth
Yeah.
grader, which means in that sense, that means it's either you can accept, okay, I'm a third grader, I'm good where I'm at, or you can just say, hey, how dare can this man read better than me? So therefore, there's some work I gotta do. That mean in that moment you are weaker in the reading sense than that person. I don't think that's something that is inaccurate.
Right. Okay. But if from a psychological perspective, would you go to your third grader and say, "Honey, your brain is weaker than that other kid"?
I feel like me personally with my son, if I see a third grader reading like that and then hear you are saying, "The house is blue," dude, you're retarded. There's this level that
And then you go ahead and book your appointment right now with me for your kid. Because the thing is, if you're implying that when you're saying the weakness, the implication has ramifications, right? That's what contributes to that stigma. And when that contributes to that stigma, people are not going to get the help they need. And that's going to lead to all of these stories that you guys have been talking about, people doing all these things, because there's stigma attached to mental health because people
like
look
us
at it
ruined
as being
But
weak.
no, but I'm just saying, listen. So that's why I stuck to my son. Like me, I got boys. I think if I had girls, I probably really like couldn't say nothing. I think I'd
Just kick back on
I'd be a terrible. Like as a dad, I don't think I would do much. You know, because she'll get away with a lot of things. But with my boys, I know as a man, life is not easy as a man. You know, girls' life is easy, more easy than a man. Right? So my boys is, so nobody cares at the end of the day. So let's say my son come home and just say, this guy was making fun of you. Cool. They say, you ugly. Are you ugly? No, I'm not. Okay then, so why are you tripping about it?
And we touched up on the tools, as you said. Those are the type of thing I faced as a kid, and I guess you may say my parents growing up hardcore was able to instill those tools within me to where now as an adult, I can rejoice from these tools. Because I feel like when you don't give those tools, yes, it's mean. It's a third dude like, hey man, you retarded because this guy can be better than you. I get the cruel sense of it. But now it hurts your feelings, and you wish you could read like this guy. So there's one thing you can do.
What you gonna do
Put
about
in the
it?
work so you can work just like this guy. To where now you can acknowledge, yes, this guy can read better than
Right,
me.
but what if we could do it without the cruelty?
I mean, I'm just, it's all, but think about it. But think about it. That's what I always say. So you know what? The world we live in. Because I set my kids up. Because the funny thing, I think like that's what the kids do. Like in Haiti, there is no the bullies thing. There's no such thing. There is no such thing because when you go to school, I mean, what you call bully, that's what we call fun because we do this every day, right? So let's say my kids come home and they say, "Oh man, Dad," he say, "I'm fat." When I look at you, boy,
You got a bit of good.
you got a bit of gut. So what you gonna do about it? He said you fat. Is he lying? No. Start doing some push-up. Start running. Start playing more. Start playing more basketball. Do something about it. So therefore, if I say, "Oh no,
He
you
shouldn't
not,"
have said that.
"Oh
That's
you
wrong.
not," "You
That's
not."
like I feel the need to lie to you to protect your feelings.
So why am I doing that for?
Well, but I think, empathy isn't about protecting feelings. So, okay, I have 3 boys.
Yeah.
Right? So you're talking about the difficulty of raising black boys.
Yeah.
And, American also. So I remember my youngest once came into the room because his brothers had said something to him or he felt left out. And he was like, "Mom, I just need to sit down and talk to you." I'm like, "Okay, what's up?" So he starts telling me about it. And he says, "I just feel like, I don't have a place. I feel like my 2 older brothers have a place, and like you and my dad. I just feel like I don't have my own place." And I said, "You do have a place. It's like you're part of this family just like anybody else. And we love you, and we care about you, and we support you, and you're always going to have us to turn to. And no matter what, even if, your brothers are playing together, they still love you. They're still there for you. You're still brothers. You'll always be a part of this family." And he kind of went, and he was like, "Okay, I could go back out now." So that, rather than being like, "Oh, you're being weak," because you're,
I'm not. I wouldn't do that. I wouldn't do that in that situation.
But what I'm saying is the implication that saying when someone is struggling with something, their mind is weaker, those things seep into our consciousness, right? As a society and as individuals. So someone that you may care about that you don't even know they're struggling may hear you say that and they're like, oh, they feel like maybe they can't get help. Maybe they feel like they can't turn to you. Whereas the support that you have, your other family member feels like they can't get that support
But
from
I
you.
guess within the ignorance of my mind, I feel like the way our support system is wired, truth, where you're coming from, give me everything, all the details, and I'm gonna give you your opinion, the options you got, pick one. Or that, cause with us, I feel like it's extremely direct. Ain't no BS and no beating around the bush. Give me everything, I'm gonna give you everything I got. And it's like, and I'm gonna give you a thing that make the most sense with everything you got, and then you can just choose one or whatever the case may be. But a lot of time when people, like you just say, you see somebody that's breaking down or having an issue or whatever, and then from the bit of knowledge you get about the situation, you're trying to help them, give them advice or whatever. But yet for some reason, the fact that they cannot resonate with the truth, I guess you may say I'm giving them, to me, it's something I can't quite understand. It boggles my mind.
Okay, so I'm gonna say something. I'm gonna hold you, like they say, I'm gonna hold your hand when I say this. No offense. That's why you don't go to your friends and family for therapy. Because what a therapist is going to do, hopefully, if they're a good therapist, is master the art of delivering truth in a way that's you're going to be able to receive, in a way that's going to lift you up, and in a way that's going to empower you, in a way that friends or family may not be able to or may not be trained to do. Like, to use your analogy, that's going to be a weakness that your friends and family have that a therapist is going to have more strength in.
Yeah, but I mean,
And I agree with that 100%.
yeah, but I mean, I get that. Sometimes, you know, let's say you never say like you live with somebody, and then you tell them,
A thousand times.
you tell them, amen, what the situation is, and they see you as just like what you said, you against them, whatever the case may be, and they go talk with somebody and they tell them the exact same thing, and they got the openness to it, like, but you say the same thing.
Well,
But sometimes it's got resentment build up over the years, and that can cause somebody, like everything you said, and like you against somebody, but truly, you was being truthful in a sense.
But it's a different dynamic. Like a lot of times when you say that, well, they're going to receive it from them differently. Well, part of that might be because part of the therapeutic relationship is cultivating an environment of acceptance and trust that they may not feel with the people in their lives, even if they live with that person.
But sometimes I think like in a lot of relationship in a sense though, it's just like, because I don't like me in the way I got with him, I don't have to agree with you. I don't have to agree with, if you come something and bring me something is, oh, she did that, I think you fucked up. But in a some people's relationship, the fact that he come tell me that, I'm supposed to be like, even though I don't
agree with him, if you disagree,
even though I disagree,
against him.
you know what I'm saying? I'm supposed to be like, yeah, you right, where she's wrong, but that's not what we have. Like, man, I think you completely want to. I think you need to think this shit through because you fucked up big time. Then you got to sit down like, But some people don't accept that though. So whenever time you say that, oh my God, whose team you on? I'm in your team all day. But you think like because I agree with the other person, I'm against you. I think that's another problem.
It's the sense where you got to be able to come back and be like, okay, how dare he say I'm wrong? Let me see where he's coming from. And I feel like that's like a sense like a lot of people don't actually have.
They don't accept it.
They don't actually accept it. Because a lot of time I call them and tell them a situation that's something that happened. I'm like, okay, I'm thinking this is going to be like, oh yeah, man, that dude was tripping big time. They're like, yeah, dude, you was tripping. I'm like, what you mean? And then we argue back and forth. And then sometimes we argue to where he says when I say out my point and I disagree. But one thing I know is, okay, let me see where that guy was coming from. And sometimes I don't even just do it with him. It's just like anybody that just got like a point of view to share with me, even if I might disagree in the moment. But I will kick back and be like, okay, let me see where that person was coming from. And then a lot of time I agree, a lot of time I disagree. So I'm like, okay, that dude was tripping overall and just moved on. And because I feel like logic is logic. Sense is sense.
Well, okay,
there's
logic,
like 10 different ways of sense.
Logic is logic, but you can have two people that use opposite logic about the same point. I mean, look at this election. Everybody would argue that they're using logic, but people are on very distinct sides of the fence.
But in that way, it's logical to me because people got different needs. Because think about it, within this election, we're immigrants. So therefore, anybody that leans toward immigration laws, if I say I'm going to vote for so-and-so, it's going to make sense to anybody that can relate to that sense. But let's just say if you're not an immigrant, you don't relate to my issues, my problem, my wants and needs, but you got your problems and wants and needs, that makes you lean toward that guy. Yes, we both disagree, but within a sense, I can understand why you're leaning toward this guy compared to me leaning toward that guy. That's why I'm saying logic is logic, sense is sense. Because when I speak a lot of times...
logic can be faulty.
I mean, it can. I mean, you can be
faulty logic.
Yeah. Sometimes your logic doesn't make it right.
Wrong. If your logic is faulty, that's what makes you wrong, basically.
Yeah.
If your logic is faulty, that's what makes you wrong. That's why a lot of times, if I, like I said, come to him about a situation, or he comes to me about a situation, I'm like, man, you was tripping. And then two ways, kind of like my logic in that moment was faulty, or his logic in that moment was faulty. And a lot of times, and the thing is, I've been called self-righteous or whatever the case is. And the thing is, I don't think I'm self-righteous because I'm always willing to open to understand, okay, where are you coming from? What makes you think I'm wrong? It's because I guess the fact that I've got a relationship with him, whenever I'm dealing with somebody else that tend to disagree with me, like he disagree with me all the time, and to where I always give him that, okay, where are you coming from? Because I'm going to give you all the details I got. I'm not going to hide anything from you. And then tell me where you're coming from. I can try to understand how I did anything wrong. That don't mean I'm going to necessarily agree with you, but at least I'm willing to hear all your details. But at the same time, that's why I'm saying logic is logic. I can hear your logic. Like you said, the logic can be wrong. But if I hear your logic and I disagree with it 100%, I'm going to tell you, yeah, my guy, you were wrong. But at the same time, if you hear my logic and you don't agree with it 100%, you can tell me, hey, man, you were wrong. It's because you should have done this, and this, and that. It's either I can agree with it or not disagree with it. That's what I'm saying. Logic is logic, sense is sense. But I guess I got
a question for you.
Okay.
So, damn, I forgot the question.
Oh no.
Man, he was right there too.
But I got like just to move out past our personal stuff. Within your line of work, like have you ever had somebody that approached you within something that for some reason, odd reason, that make them super depressed, and then within your personal life, to where you're thinking, okay, that shouldn't be that deep, and how do you even address that situation?
Well, I think everybody has their different perspective, right? So usually it's deep for that person because of some underlying reasons. So for me, I'd be like, I get curious is what I do. So if I'm like, okay, so they're that depressed over this, let me figure out what that's about. And so I start asking questions and getting curious. And then I start to see the connections of why. Because sometimes on the surface, what we're depressed about is connected to something much deeper. The other side of that is that I also deal with a lot of trauma. So a lot of people, but I'd say probably most of the people I deal with are depressed on some level because they've dealt with some pretty significant trauma, right? Even if they haven't had... there's different types of trauma, right? Like there's some trauma that's going to be really deep-seated, long-held trauma, and there's going to be some trauma that, like it's a broken heart. That's still traumatic in some way, right? I describe trauma as experiencing something that we weren't necessarily created to experience, right? And there's sort of like...
I can understand that.
Right. So that's what... so when somebody says something, I get curious about it.
So I remember my question now. My question is, me and him, we had a podcast where we argue big time.
Okay.
Do you think somebody can change their personality?
Can change their personality?
Yeah, who
Yes.
they are. Like change it, like do a full 180 on it.
Are you talking about like a personality disorder?
No,
not
first,
disorder.
yo,
Let's just
who
say
you are,
Yeah.
you.
You think that's a possible thing?
I mean, usually it takes something pretty big for a person's personality to change, because it's something that's very deep-seated and that starts to develop very early in life. So I think it's possible, not necessarily likely.
So, but my point was, it's just like, because personality is the way you think, the way you think, the way you feel, and the way you act. That's become your personality.
So the thing is, though, like to simplify it for in a sense so you can fully understand, do you think somebody that probably for 25, 26, 30 years of their life were like an introvert can able to do a 180 to all of a sudden they outgoing and talking and being friendly to everybody?
But to go back to what he's saying, so I'm just saying, let's say somebody, the way you're saying, yes, you're an introvert. Cool. I like being an introvert. What's the point of me trying to be an extrovert? But let's say if I wanted to become an extrovert,
You
eventually...
Not eventually, you could.
You could. Don't you think that's a possible thing to do?
I mean, it probably take a lot of work.
But this can happen.
Possible.
I still disagree on that.
I just feel like because
let's
let's say for instance, like, okay, people say, I'm from Haiti, right?
Mm-hmm.
I grew up without nothing. But people think I'm bougie as fuck, right?
Mm-hmm.
That's cool because at the end of the day, I always say between me and Bill Gates, the only difference is he got the money, I don't.
Mm-hmm.
but I think like a billionaire, right? In my mind, I visualize myself like this. I think like this. I act like this.
That's
I
a
feel the
wildly
way.
arrogant shit to say, but
I mean, I'm just saying, but that's why I act though. So therefore, it's to me, if I find $1 billion tomorrow, in my mind, I already know how to use it.
You already have a plan.
Yes, because I live in this. I visualize it every day. I think about it. So therefore, I'm not even forcing myself to be bougie. I like to be dressing. I like to be looking good. I like, expensive stuff. I like, you know what I'm saying? So therefore, when somebody see me like, hey, man, this dude is bougie. But to me, I'm just being normal. You see what I'm saying? So therefore, but it's over the years I've done that. I think about it all the time. I was being broke. I want to be rich. I'm thinking about it. So I feel it. It's just dropping all those, dopamine in my body, make me feel good. Like, oh my God, Then, I start acting like it. That become my personality, right? So
Well, it sounds like something you've cultivated over years and years and years.
yes, so that become my personality. So that's what I was telling him. So if I wanted to be somebody else, you can do it. I'm not saying you can like that.
All right,
Do
let
it
me tell you what,
eventually. You
if
can
it
do
was
it.
so easy to do, right? If it was so easy,
I
to
never
do,
said it
that's
was easy.
But if it was so easy to do, why you think when they got like certain actors, like whenever they casting somebody for a certain movie, they gotta go after a certain actors. That's why they got casting to where can your personality match this the actor we're looking for, like the kind of you got that type of actor that can match that type of personality we can actually.
You know what? I disagree on that one because the reason I said, let's say for instance, so let's say I wanted you to play some kind of character. So let's say if I can just do casting and I can find somebody and the personality that's closer to that. So that's mean you would take me 3 months to get to that personality that I want you to play. But I can casting and find somebody they can get to that personality in 2 weeks. Why not go to that person? You see what I'm saying? So anybody can do any act you want them to do. It just might take a longer time to do so. But if I can find somebody casting 10, 20 people and see, ooh, that's close enough. I like that. I can work with that. You see what I'm saying? So therefore, sometimes that's why I think you can change your personality. You can be, I don't think something like where people say, that's who I am. I don't think that's the thing. I think that's who you choose to be.
Yeah, I mean, there's always opportunities for growth in any direction. I think sometimes people maybe put on personalities. Like maybe they say, okay, like I need to be like this for this circumstance, right? And so maybe they put on a person, almost like a mask. Like we all have like a mask that we wear, right? External, like our PR person, right? Like our public facing persona.
We all
right?
do.
Yeah, everybody
whether we
has
want to admit it or not, we all do.
yeah, and people change that sometimes, right? Like you'll see that. What was that? That recent controversy on I think it was TikTok, where it was this lady. It was a black woman married to a white man, and she had built her platform around, oh, like this man is spoiling me, and he's doing all this, and then it turns out she was paying for everything. But I mean, that's
as I said, social media is not a real place.
That was a sort of it was a persona that she
yeah.
put on, right? Like, and so there are those aspects where it may look like someone's changed. Maybe they've just put on a persona, and they haven't necessarily changed inside, right? Like you even see that in things like narcissistic personality disorder, right? Like they can put on a persona, right? And then as you get to know them, that mask can only stay up for so long before it starts to slip.
So let's talk about narcissistic.
Narcissistic, that's the question I got. Within your personal opinion, I'm sure you've met a lot of people who've been accused of being narcissistic and so on and so forth. Even I, a few times, been accused of being it also.
I'm a big one.
What's
What's
the difference within your personal experience between narcissistic and confidence?
Okay, so I think the line between confidence and narcissist is
thin.
It's not necessarily thin. It's just a narcissist would need to put other people down to feel good about themselves, right?
Okay.
Because in reality, narcissists might appear confident, but a narcissist actually has a very fragile ego.
So let me ask you this. So everybody's narcissist, some way, somehow. It's kind of like a spectrum.
Everybody got an ego out there.
It's a spectrum, so who's worse and who's less, right?
There's healthy narcissism, right? Because I don't think someone would be healthy if they were completely absent of narcissism, because then they would never look out for their own self-interest. And that's necessary, right? That's necessary for survival. So there is a spectrum in that there's healthy narcissism And then you may have somebody that has narcissistic traits, right? And then you have someone that's maybe a little bit further on the narcissistic spectrum, and then you have full-blown narcissistic personality disorder.
Yeah.
And then even if you go a little bit past that, you have sociopaths and psychopaths, which is like a dialed-up version,
Yeah.
right? So there is a version of healthy narcissism, but that's not going to be the same thing as somebody that's a narcissist.
To touch upon like something you said earlier, like you said, like a narcissistic person is like somebody that's always putting somebody down so they can be better or whatever. And I got like a story of somebody that I know, because like I said, I stay active and I, like for the most part, go to the gym, run or whatever. And I know this person who wanted to get within that lifestyle also. And the first time they started doing it for 2-3 weeks and then fell off for 6 months, 8 months. Then got back on it 2-3 weeks and then fell off again. I never judged them for it because, okay, you're not about that lifestyle. And then for the third time, they were preaching to me how this time they're going to commit. And I'm like, dude, who are you lying to? And then they claimed that I was just putting them down, I was being narcissistic. That's how, to their definition, that made me a narcissist, because I told them, dude, I know you're not about that life.
Yeah.
Like, what would your opinion be on that matter?
I mean, that word gets thrown around a lot, especially now. I think it gets thrown around in a lot of ways where it's not accurate, right? I don't know if you could tell just in that instance if you were a narcissist.
But that's what I was
Yeah, but I mean,
accused of.
I think a lot of times when you don't agree with somebody, so let's say for instance, cool, you did something, you know, like sometimes I think me, I've understanding since I was a kid. I think I don't know where it come from, but like I was born this way. I understand things, right? The most people. So let's say you bring something to me. I can have empathy, right? Yeah, cool. Yeah, I see you right. Yeah, I see that. I mean, you could have done this, and you could do this. Let's do this. Let's do that. Cool. All right. Then again, the same situation again, and like, okay, man, cool. Let's do this. Let's do this. Let's do that. Then the third time, I'm like, okay, man. So then now when I become that, give it to you straight, like, okay, I think you're full of shit now because you're not doing what you're supposed to do. So therefore, you could have done this, but you chose not to. Then all of a sudden, you just against them and you become this narcissistic person, but they forget the 3 times that you was like
You showed empathy.
You was right there with them, like, hey man, let's do this, let's do that. But then you get blamed for it in a sense. Is that a narcissistic thing?
No, I mean, I think narcissists are going to generally be very manipulative. They're going to struggle with empathy. They're actually going to have a really hard time with empathy and seeing things from other people's perspective. And depending on the type of narcissism, they're going to like pit people against each other. Like a narcissistic parent might pit their children against each other to win their affection. Do things like that. So it's highly manipulative. Things like gaslighting, to where I could say like, oh, I like your black shoes. They're not black. What are you talking about? I think you're looking at this wrong. So there's constant twisting and turning. They lie, they cheat, but they like to put out the appearance of having it together because their ego needs to be fed, right? They have to get that narcissistic supply from other people. Ironically, a lot of times narcissists accuse the people in their lives of being narcissists.
Yes, there's like a projection.
Yeah.
But I mean, to me, in a sense, like, I'm not perfect. You know what I mean? Sometimes, like, I think I'm very direct in a sense. Sometimes
you lack empathy.
because I'm so direct in a sense. It's just like it's a lacking because you're not having that understanding. But it's not true though. Sometimes I feel like, let's say if he brings something to me, right? The first time you say, hey, I got something to tell you. Shit, I'm open. Now I'm trying.
You got all the empathy in the world.
Hey, you got because only thing at the time is because as a man, as I'm wired, is find solution. So when you bring a problem, something to me, I'm trying to, like, my mind is running, like, everything you say is processing. How can we solve this? How can we solve this? How can we solve this? But some people, when they bring in the thing to you, they're not looking for solution. They're just looking for you to say, oh, that's
I
so
see where you
cool,
man. That's
man.
man. Poor
I mean, but I'm just saying, but to me, but you get what
Right.
I'm coming from. It's not like, I guess it's not my fault, but I'm just like, if I bring something to him, I don't looking for him to say, oh,
Man, poor guy.
man, you know what I'm saying? I don't want that. I want the like, hey,
what can I do about this?
yeah, what can we
what's
do?
the solution?
What's the solution? So therefore, I think as like when you deal with a woman, is different. You know what I'm saying? Sometimes like they just want a hug, but like to me, like hugging doing shit. In my head, like you know what I'm saying? Like
After I'm done hugging, they're probably gonna be there.
you know, I get.
Look, and actually, I would beg to differ. Actually, hugs do a lot for your system. They do a lot for your. Yeah, it's gonna.
I mean, I'm not saying that you're wrong.
I'm gonna tell you what I do.
I'm not saying that you're wrong.
Hey,
Hugs
maybe
do a
you're
lot.
right within the
They
American
actually
world.
do.
Maybe
Yeah.
within the American world they do. I remember when I first got here, because when I
No,
first got here, I was
any
15.
world.
No, believe it or not. when
There's
I
no
first-
such thing as hugging.
No,
Hey,
listen. When I first got here, 15 years old, going to high school, I went to La Grange High School, and I was in 10th grade. And I remember I used to see kids coming all day hugging each other. That was the weirdest thing for me to see.
yeah, I don't think we do that. I don't think it's not a thing.
Well, actually, we're as a society are very under-touched. We're touch-starved. But in reality, yeah, I think I read something. I think the other day, it says it's good to have like a 20-second hug every day. There's something that it does to the systems in your body.
What if
I'm
you go
gonna
for an
try-
extended long
Regulate
period
your
of time
systems in
where
your
you don't do it?
But we said the funny thing is like
Okay, because you have to consider, again, remember how we talked about emotions being important? Connection is also important.
I agree with that 100%. Yeah.
Right. So one of the ways that we connect is through touch. And it's a way that, unfortunately, I think has been sexualized too much to
Yeah.
where we don't understand the importance of non-sexual touch. It actually is very healthy to have certain levels of non-sexual touch in your life. As a matter of fact, babies, when they're born, they did an experiment. I can't remember if it was in Russia or in another country in that part of the world, but it was an orphanage, and they had babies in the orphanage. They were cared for, they were fed, they were diapered, all these things, but they weren't really touched. They weren't held, they weren't cuddled, they weren't rocked. The baby started dying because they were missing that connection. That's how important physical connection actually is.
But if I tell you my mom and my dad never hugged me my whole life, would you
yeah,
think
but I
that's
mean,
weird?
but you know, what's funny thing is,
Why don't you give me a call?
funny thing is, like now I can like a thing is a thing here. You know, I can say my mom. Now I'm used to it. I can say my mom, I love you, in English, but I cannot say it in Creole.
It sounds odd.
It sounds so messed up. Like I can't say it to anybody in Creole unless if it's a woman, because that's what we
But I think
accustomed
there's a
to.
difference in culture within.
You know
this
what I
whole
mean?
thing.
Because there is no
I
such
feel
thing like I love you.
So
There's
think
no
about
such
that.
thing.
You just said that you can't say it to anybody except for a woman. So are there some ways where, and I'm just asking, this is a question, where maybe touch has been, and that kind of affection has been sexualized for you, to where non-sexual ways of connecting like that feel awkward?
Nah, not really. No, but I'm just saying.
Maybe I feel like she got a point, and it's what she's saying. Let's think about it. As much as we talk, as often as we talk, sometimes 2-3 hours calls. Would you ever imagine at the end of the call, I'm like, hey man, love you?
And there we go.
I mean, if it sounds so, I mean, I'm just saying. It's just like, hey man, love you, bro.
Man,
Come
nah.
on,
I mean, like I said, in a sense, I feel like there's like a word. The culture difference also created like such a. Because I feel like that's what it is.
Well, see, I don't know if it's necessarily a cultural difference. I think that there are men in America that have that think the same way.
But I mean, here they do it a lot. Even a relationship,
a lot.
even in Haiti, like relationship you have with a woman, it's not every time you say it when you leave, like, I love you, I love you. There is no such thing. It's not a thing. You know, you say that, like, you know, and you know, funny thing is in Haiti, like it's crazy, right? When you first meet a woman, you see the most craziest shit you can think of. Oh my God, the first time I see you, I couldn't sleep. Oh my God, I mean, I couldn't eat. It's just bullshit, right? I love you, all this thing in the beginning. That's things you said in the beginning. Here, you say a woman, I love you in the beginning, she think you crazy. You see how the culture difference is? It's literally very different because you can only say I like you. And he's just like, and even though when you say it for the first time, he's like, oh, did he say it? You know, those 3 words, that's like a big deal. But in Haiti, shit, the stuff you have to say, I mean, it makes no sense whatsoever.
But is it authentic? Like, are you actually?
No,
Because,
it's not. It's just a thing. Like that's what the
just to show
woman
you how
like.
weird
Though.
a different thing is.
Okay.
Like in Haiti, we speak 2 languages: French and Creole. Like Creole is considered a broke people language, and French mean you just classy. That's how they look at it. So therefore, they gauge your education or how smart or how noble you are, depends on how smooth your French is, like how deep your French vocabulary is. It's a weird thing in Haiti. So therefore, and French is known to be like a romantic language. And therefore, like whenever, let's just say you see a girl that you like, and I guess in a sense of you, I guess I know flexing to that girl, you gotta approach her in French.
Like poems and all this stuff.
Like
Like,
poems in the whole nine yards. So
and
therefore, by doing so, you gotta say the romantic stuff that don't make no sense whatsoever, but that's part of the culture.
I mean, like the crazy. And then it took me a while. It took me about like a solid 2 years because, in Haiti, you play those little games. Come here and saying these things like,
You sound great.
women think like, man, what's wrong with this dude? This is like a crip. Why would you say so no nonsense stuff? Like, you know what I mean? Like, what the fuck is this? You know what I mean? But to me at the time, it was like, it's the most romantic things you can say to a woman.
I think the thing is, the issue is, I got here younger. I got accustomed to American culture a whole lot faster than he did. So, I guess I don't know, creepy stage you went through. I didn't have to go through that stage.
But man,
But
so
man, this was like a genuine conversation.
man,
and I know we kind of made it about ourselves. And trust me, we were talking about not trying to make it, because we like, whenever we talk among one another compared to people we've met, we always felt like there's being this huge gap between the way we see the world, our mental or whatever the case might be. And then before we came in today, as much as we were looking forward to this, and I'm like, man, dude, we got to watch out to where we don't make this too much about ourselves, to where we allow her to speak from a experience or whatever the case might be. And I felt like we failed at it. So therefore, in that
it
sense,
wasn't too bad. It wasn't too bad.
I think it was a good dialogue.
So let me so we like to do like it's just like we ask you some questions.
Okay.
And then like the first thing that come to your mind that you said, oh, she like that. Go ahead. Guess the first question.
first question is, knowing that you know now, like having the experience that you have, having been able to, I guess, in a sense, cure or help people, go through their trauma or whatever the case might be. If you had a chance to speak with your younger self on that subject, what advice or heads up you would give her about the whole subject?
Believe in yourself more, and that you're stronger than you think. And I think it would be believe in yourself more, and that you're stronger than you think, and you have more support system than you realize.
And I got a question also. Clearly, you're a professional. Have you ever met a patient that came to you with some, I don't know, whatever the trauma might be, and then within your personal self, I know you can't do it because you're a professional, you gotta, deal with it professionally, but within yourself, you'd be like, man, what the hell wrong with this dude?
Wait, I say what?
You said what now?
What the hell wrong with that guy?
I think there's been some times where I've had clients that have had really extensive issues, right? But to be honest, more often I'm inspired by them, because to hear what because I've dealt with people that have been trafficked and all kinds of things, and to be able to see how someone can go through something so horrible and survive it and make it through, and then still come out and say, hey, I need help with these things, and to be able to be in that space with them to help them develop and grow that way, it's actually really inspiring. I get inspired by my clients all the time.
Do you think therapists need therapy?
Oh, yeah. Look, I tell my clients, if your therapist has never been to a therapist, get a new therapist.
Really?
So do you think
Yes.
So do you think when people bring you so many things, is that affect you in a sense emotionally over the years? Like you just like working,
some story
just
that
like,
is so traumatic to it affect your own personal life.
yeah.
Yeah, I can't, because you're a human being, right?
Yes.
So yeah, it can definitely affect you when you're, and the thing about being a therapist is that you're establishing relationships with people, right? I mean, yes, it's what I do for work, but I'm establishing a relationship with my clients, right? Like there's a back and forth, because you can't delve into that sort of depth, right? Emotional depth, without developing a relationship and creating a safe space for that. So yeah, there's going to be space where that affects you. But I think the way that I look at it is that if they were able to live through it, then I can listen to it. And so I work on being able to regulate myself in that way so that I can be there for them.
So do you ever in a sense somebody come to you and telling you something that really affected you in a sense, but then you go to your therapist because you can't you can't talk about it, but you just generalize that situation just so you can hear
Their perspective on it or whatever the case might be.
Yeah.
Like, because what I mean by that is, like, to clarify, let's just say, like a client approach you and tell you they done something like extremely disgusting, like had sex with a 6-year-old girl or something extremely disgusting, and like I can't forgive myself or whatever. And then don't you think, of course you're a professional, but within your personal view, wouldn't that disgust you to where you got to tell that person, hey man, I think you need to find another therapist?
You have to, as a therapist, you have to report that.
You got to report that?
Yeah, she gotta report that.
I have to
Oh, she gets
report that.
snitch on you? I didn't know that. I thought everything was confidential.
No, man, you can't do that,
Somebody's
man.
telling me that, I have to report
So
it.
therefore, if
Man, that is
something that's against the law in any sense, you got to report it.
Not in any sense. Okay, so if someone is telling me something like that, where it's a danger to a child or someone elderly, or if they're thinking of committing suicide or homicide, I have to get help with that.
Oh.
So if someone comes in and they're saying that I want to commit suicide, they have a plan for committing suicide, then we have a discussion about, okay, you have to, and I have had to call an ambulance to come get someone from my office before.
But I mean, I want to clarify on this. So the fact that you take that example, it's kind of like, that was not the best example. I'll let you know right now.
No,
Take
I
it
feel
like
like it was
I know.
nothing, just to show you, like,
I don't
in
think,
a nasty
but
way.
I just said I know. But with the fact that you said, "Oh, you can snitch on,"
Yeah, no.
I didn't know that.
I mean,
Hey, I always thought like therapists were like lawyers, because I understand with lawyers they cannot tell like whatever you. Like,
Lawyers
I
can.
felt like in a sense it was
there-
kind of like that.
There is confidentiality. So like, but it depends on if somebody is like, for the instance you use, somebody's being hurt. So I have to report that somebody's hurting.
So
a
therefore, you
child.
don't have to approach it as let me trying to
If
switch that
somebody's
person's
like-
mind to not do that stupid stuff, like that nasty stuff
No, if
ever
somebody's
again.
like, "Hey, I'm selling weed on the corner," no, I don't
Okay.
have to report that. If somebody is like abusing someone, if someone
I
has a
understand that.
plan to kill someone
I
else,
understand
Yeah.
that. I
I have
understand
to
that.
report that.
Okay, that's interesting. Also, earlier you kind of touched back on your background, your education. You said you started in New Orleans. Are you originally from Lake Charles, New Orleans, Louisiana? Where are you originally from?
Originally from Lake Charles, born and
Okay.
raised. I went to school in New Orleans, and I was there until Katrina moved me back.
Okay, because I kind of asked that to ask you, what's your favorite restaurant in town?
This in Lake Charles?
Yes, ma'am.
Okay, listen, I'm a foodie, so
So
I
you
love
got plenty.
food. So that's a really tough question. Is
Oh,
to
top
ask-
3. Make it easier.
Top 3. Okay, so I like the burgers from Cala. Those are really good. I like the lasagna from Joe's Pizza and Pasta. Also like their cannolis and their Caesar salad. And I like Daryl's Po' Boys.
Who don't love that? Who don't love that?
That was kind of fell off.
You feel like it's overrated?
it fell off. I think they fell
I
off.
haven't
I
been
mean, I
there
haven't had
recently
it in a
though.
while.
Yeah, they fell off to me.
I haven't been recently, but I feel like it's pretty good. Last time I had it, I want to say give or take 6 months ago or so, but
Oh,
I
yeah.
feel like it was good enough for me.
It's just like it's a hit and miss now. You can go one day it's so good, and the next day it's not that good.
Really?
Yeah, they fell off. But let's say if you had to eat one food for the rest of your life, pizza not included, what would it be?
Oh, it wouldn't be pizza. One food for the rest of my life. Oh my goodness. Lasagna.
That's an interesting choice, honestly.
Lasagna.
I agree with that 100%. I feel like I could back that up, honestly, because I'm a big fan of lasagna.
Lasagna.
But to conclude this thing, thing is, as you said, as we spoke within this show and also off camera, you said you feel like everybody needs therapy. It doesn't matter where they're at in life, because a lot of time people don't really feel like they do until things, getting out of hand to where they cannot control it anymore. And then within having this conversation with you, and I'm not as self-righteous as I may seem, to where like right now I am genuinely interested in seeking therapy. To where I guess, in a sense, to me, it would be some sort of experience to where maybe if I have like a professional guiding me through my thoughts or my feelings or emotions, would I be able to handle them differently? Even though, granted, I feel like the way I'm handling them right now, I'm just fine with them. But at the same time, I'm like, it opened my eyes in that sense to where I'm genuinely, when I want to get you all your information. And also, just for the sake of it, though, like, is there any information about yourself you want to give to people who, like, might be able to see this and want to reach out to you for whatever issue they may be dealing with?
Sure. So my nonprofit is called Salt and Light Collaborative. So I have a team that helps me. We provide therapy. So you can go to saltandlightcollaborative.com. That's our website. Our phone number is area code 337-426-1144. We're also going to be starting soon these, I'm going to call them like skill builder workshops for now, but it's like covering different topics like narcissism, right? So if you're in a relationship with a narcissist, how to navigate that. Because what I find a lot of times when people try to seek help and they're in a relationship with a narcissist, someone will say, well, you just have to communicate, you have to do this, but that doesn't necessarily work with a narcissist. So there's kind of specific skills that you need to develop to navigate a relationship with that type of personality.
So do you also offer couple therapy as well?
Yeah,
Okay.
couple, families, groups. So we're going to be doing some groups based on things like topics like that, but also topics related to like maybe like mental health books, like The Body Keeps Score, which is really good about trauma and how your body holds on to your trauma. So you can also follow me on Facebook, Julie. It's going to be, I think, Julie Darbone on there, Julie Este-McDonald on Instagram, and I mean, maybe YouTube. We'll see.
So, but I mean,
You planning on having a YouTube channel?
I think I might.
I think you should.
Yeah.
I think especially within that field that you are, it's an interesting field because like you can tell a lot of people struggle with their emotion one way, shape, or another. Whether they were like, I struggle, he's as strong as I may seem to be on camera or whatever the case might be, I struggle with my emotion as well. So within that field that you got going on, I feel like that would be an interesting topic. Because if you think about it, what's that Canadian therapist that's like extremely popular that everybody follows?
oh, you talking about Jordan Peterson?
Yes, him.
Oh, yeah.
So therefore, I feel like in a sense, you'd be like a 2.0 version of him in that sense.
Okay.
Because therapy is extremely important.
So I mean, I don't think to me, I don't think I need therapy.
Okay.
I think I need a coach. It's the same. It's kind of like the same
Slightly
thing.
different.
Slightly different. I just somebody that can just like guide me through like where my weaknesses is, how I'm looking at how to be a better leader, how, like stuff like that. That's what I feel like I need eventually, because even the greats, even the people that's the best of the best, they in the background they got somebody they come and talk to them like
And coach them and
and
guide
coach
them in
them
a
like
sense.
so from seeing from different point of view, how to teach them how to be like a better leader, trying to be like a better person, trying to help the people. Let's say like people, billionaires, they got businesses and stuff like that. So usually they have people like this that help them like manage employees and become like better. So I think eventually that's what I would want to be the greatest I'm trying to be.
But
like
honestly,
that's basically what I'm getting my PhD.
yeah, and honestly, that's what I'm looking forward to. Like I said, that's something I'm willing to try. Like off camera, like you already give your information, but off camera, I'm gonna get everything to write it down, and I'll be reaching out to you soon just for the sake of trying it to see what do my emotion
See
likes.
what it's about.
Exactly.
Okay.
I mean, this episode right there was very like a episode that was therapeutic. That's something I was looking forward to because like I said in the episode when we were talking, they got bad stigma about therapy, and then being the Black community, being a man, you got to be strong. Showing your emotion is a sign of weakness, and all these other things. So I think we had a chance to cover like depression, anxiety, narcissism. I think this was like one of the best episodes so far to me, and I was looking forward to it. And thank you so much for coming to the show,
Thank you
Julie.
for
That was
having me.
really a good show. Thank you everybody for watching. Thank you for supporting this channel, and we couldn't have a better show, and that's the reason we have people like Julie Este-McDonald on the show to teach us stuff like that.
There you go.
Thank you so much.
Debunking podcast. Follow, share, subscribe, and the whole 9 yards. Leave a comment. Let y'all know how y'all feel about everything that we said, and feel free to express your emotion in the comment section. We're gonna leave it at that.
Oh yeah, that was really good.
Man, that was really good. And I got me personally, when I finally, in a sense, open up to somebody, I feel like to apologize, in a sense, 'cause I know they won't forget
No.
it. In a sense, because I know we can't come out, at least me personally, come out asshole-ish
No, I enjoy
or
it.
whatever.
But it's also like a viewpoint that a lot of people have. So I think it's important to like talk about it and go back and forth.